Good evening, everyone. So our topic for today is zinc. Introduction. So zinc is an essential trace element. Role of zinc over 300 metalloenzymes and over 2,000 transcription for regulations of lipid, protein, and nucleic acid metabolism and gene transcription. So about 99% the total of body is intracellular. So zinc is present in all body tissues. So we have 60% in skeletal muscle, and we have 30% in bone, and 46% in the skin. For recommended dietary allowance or RDA, we have infants, so 0 to 6 months, we have 2 milligram per DL, and 7 to 12 months, we have 3 milligram per DL. In children, we have 1 to 3 years, 3 milligram per DL, and 4 to 8 years, we have 5 milligram per DL, and 9 to 16 years, we have 8 milligram per DL. We have adolescents and adult. We have male age 14 and over, 11 milligram per DL. In female age 14 to 18 years, we have 9 milligram per DL. So in pregnant and lactating mothers, we have 25 milligram per DL. So in physiological functions of zinc, so biochemical functions, we have cofactor for enzymes and activity of zinc finger proteins. So in cellular functions, under this, we have growth and cell development and cell membrane integrity and tissue growth of and repair and wound healing. So in immunological functions, we have functions of neutrophil, T cells, and B cell and NK cells. So next is endocrinological functions. First, we have production of spermatogenesis. Pancreatic functions are insulin storage and release. Next is thyroid functions, prolactin secretion, thymopoietin synthesis. And next is neurological functions, so cognition, memory, taste, acuity, and vision. So in skeletal function, we have bone mineralization. Last one is hematological functions is coagulation factors. And zinc deficiency. So the true prevalence of mild zinc deficiency is not known because of the non-specificity of symptoms and imprecise diagnostic methods are common developed in countries. So indirect diagnosis by supplementations of zinc 1 to 2 weeks improvement in symptoms. Zinc deficiency causes. So we have dietary zinc depletions, low zinc diet, binding of zinc phytates, fiber, iron, and copper. So next we have burns, malabsorption, chronic renal disease, Crohn's disease, cystic fibrosis, and last is liver disease and alcohol. Zinc and immunity. Impaired phagocytic functions, lymphocyte depletion, decreased immunoglobulin productions in T4 plus, Ta3 ratio, and decreased interleukin-2 production. Zinc deficiency in clinical features, we have mild, moderate, and severe. So we have here in mild, we have depressed immunity, impaired taste, smell, onset of night blindness, decreased spermatogenesis. In moderate, we have growth retardation and delayed puberty and adolescence. So hypogonadisms in males, rough skin, poor appetite, mental lethargy, delayed wound healing, and night blindness. In severe immune suppression, we have frequent infections, bullous pustular dermatitis, diarrhea, and alopecia. Zinc toxicity. Doses up to 10 times tolerated. So we have acute and chronic. So in acute, poisoning 1 to 2 grams zinc sulfate. So first we have CF, nausea and vomiting associated with irritation and corrosion and gastrointestinal tract, acute renal failure, tubular necrosis or intestinal nephritis, and symptomatic treatment. So in chronic intake, we have greater than 100 milligram per day may be associated with copper deficiency. So the treatment is EDTA. Treatment, dose elemental zinc. So in infants and children, we have zero point 0.5 and 1 milligram per kilogram per day, 1 to 3 divided doses. So, in 1 to 2 milligram kilogram per day, acrodermatitis enteropathica or Wilson's disease. So, in 3 milligram kilogram per day, so diarrhea treatment malnourished for WHO or UNICEF to 2004. So less than 6 months of 10 milligram per day for 10 to 14 days and greater than 6 months 20 milligram per day for 10 to 14 days. So acrodermatitis enteropathica. So AR inherited partial defect in intestinal zinc absorption. So next is includes the protein that appears to be involved in zinc transportation. Last is erythematose and vesiculovolus dermatitis. So this picture it shows in the children that having an acrodermatitis enteropathica. So ito yung picture. Okay, next is diagnosis. Blood investigation is zinc in plasma. So spectrophotometric erythrocytes and neutrophil lymphocytes and hair. So less than 60 microgram per DL. So hypoalbuminemia, decreased levels. Zinc levels is lymphocytes. So less than 50 microgram per 10 to the power of 10 cells or granulocytes of less than 40 microgram per 10 to the power of 10 cells. So depressed serum alkaline phosphatase levels. So this is the zinc excess and zinc deficiency. And that's all. Thank you. And